Hi, my name is Heba, and today in my presentation we'll learn more about the chronic obstructive pulmonary disease. If I asked you what is the top 3 causes of death, you may think cancer, strokes, heart diseases, but according to the Global Initiative for Chronic Obstructive Lung Disease 2020, COPD is currently the 3rd cause of death in the world. And in the States, the estimate for COPD numbers to be in the range between 12 million and 16 million, in addition to 12 million undiagnosed COPD. COPD is a common preventable chronic inflammatory lung disease that obstructs the airflow. Major concern for COPD that even if you can treat it, but the airflow obstruction is not reversible. Now, let's move on to who affected. The risk for developing COPD increases with individuals which may experience asthma, tobacco use, exposure to dust and burning fumes or fuels, and genetics. Even if it's uncommon, the genetic disorder alpha deficiency remains cause of some individuals for COPD when combined with the other environmental stuff like the tobacco use or the exposure for the pollution. Now, the causes for COPD. COPD is caused in most cases by inhalation of pollutants such as cigarette smoke or occupational exposure to dust and chemical or fumes from burning fuels. And as we mentioned earlier, the genetic disorder alpha deficiency. Now let's consider anatomy and the system affected. COPD slowly damages the lung and affects how you breathe. Normally, air flows down to the trachea and into the lungs through the bronchi, which divided to small bronchioles, which end with alveoli. It has thin walls, and at that point, when you exhale and inhale, the oxygen and carbon dioxide is exchanged. The whole process depends on the elasticity of the alveoli and the bronchioles. The chronic pulmonary disease causes the bronchial tubes and the alveoli to lose this natural elasticity. So some air left trapped in the lung when exhaling. Now, let's talk about 2 main conditions you may experience or they may lead to COPD. Emphysema is one of them, which means it's a case in the lung when lung destroys the alveoli. It's lung disease that the alveoli get destroyed and it's not elastic anymore. And you may see it here in the diagram figure 1, that all walls get fused together and they lost the elasticity. And the other condition is the chronic bronchitis, when it is inflammation in the bronchial tubes, and people experiencing that they suffer from mucus because like the lung causes that mucus to overcome the inflammation, to clear the airways, as shown here. This is the normal one and this is the inflamed one. Now let's talk more about the symptoms. So most characteristic COPD symptoms will be the chronic and progressive dyspnea. People who experience dyspnea, they describe that it will be like something increased effort to breathe or chest heaviness. And the other main characteristic will be the patient experience cough with mucus. The other symptoms will be something like shortness of breath, wheezing, chest tightness, or more frequent respiratory infection. With the disease progression, patients could experience something like lacking of energy, unintended weight loss, or swelling in ankles, feet, and legs. I want to point for something here that some of the symptoms I had mentioned earlier only become visible when the lung has significant damage. And for the diagnosis, the first step for diagnosis is establishing well-detailed medical history. It comes by check the patient's exposure to risk factors, or if he has any history of asthma, allergies, or he has family history of COPD. The second step is by physical examination. And even if the physical sign of COPD not obvious till late significant damage, but one of the ways to diagnose the COPD will using device called spirometry, which is common office test used to assess how well you breathe, how well you inhale, and measure the exhale, and then how quickly you exhale. Now we have to talk about the radiologic images. For COPD, CT scan or X-ray is not useful to establish a diagnosis for COPD. They may use it as to rule out some other diagnoses. Now we'll turn to the treatment options. Unfortunately, there is no cure for the COPD. Any kind of medication therapy it will mainly use for reduce the symptoms, or to make it less frequent and less severe. And for prognosis, COPD affects individuals differently. So in some cases it will be mild and it could be severe. The stage at which COPD patient is at can be determined using more tests, other tests, something like a pulmonary function test. It could help to determine which stage the patient is at. To summarize, COPD is a chronic and progressive disease which characteristic by chronic coughing with mucus and dyspnea, shortness of breath, and it represents a group of lung diseases that block the airflow, and the cause irreversible damage to the lung. There is no cure, and all the treatments will be for help the symptoms or to reduce the risk factors and calm the symptoms. I'm done for today, and I'm happy to take any questions.